Hello, everyone, and welcome. My name is Charmaine Everett, and I'm a Senior Manager of the Provider Relations Department at Magellan Healthcare. I would like to welcome you to the Interventional Pain Management Provider Clinical Training Module. Our Interventional Pain Management program manages the medical necessity review for non-emergent outpatient interventional pain management procedures through a prior authorization process. This program ensures quality and consistent care across all health plan providers. The purpose of this training is to increase physicians' awareness of the medical necessity guidelines so that your clinical documentation can better support these IPM requests. I am excited to introduce Dr. Michael Casaro, who not only brings his experience as a radio host. Dr. Casaro is the medical director of our interventional pain management program. Dr. Casaro has been with us at Magellan since 2017. He started with reviewing IPM cases as a physician reviewer and then to a senior clinical reviewer. Dr. Casaro has over 30 years of practice experience with more than 20 years as a private practitioner in the Louisville, Kentucky area. As the medical director overseeing our clinical policies for the IPM program, Dr. Casaro is always eager to participate in on-site or telephonic engagement activities to ensure a seamless process with your office. Please welcome Dr. Michael Casaro.
Thank you, Charmaine. My purpose here is to help everybody get all of their requests that meet medical necessity criteria approved the first time through. In order to accomplish that, I'm going to give you a few tips and then go through each of the points on this slide for ways that you can get your requests authorized the first time you submit them. First, starting with some tips. Please send us recent notes. We know that there are plenty of patients that the last time you saw them might have been a year ago. You had given them some treatment. They were doing well the last time you saw them. And you said, just call me when you need me again. Well, they called this morning and they told your staff that their back pain had been building up again over the past couple of weeks or so, and it's now to the point where they need another one of those epidural injections. Please don't send us the notes from a year ago. They're irrelevant to your current request for an epidural injection approval. Send us the telephone note. Keep a list of questions posted by the telephone for your staff to ask when the patient calls for an appointment like that. Ask about their pain level, ask about if they're doing their exercise program, ask how much relief they had from the previous procedure and how long it lasted. Write those things down, send us that telephone note, and we can approve that request based on the phone note without you needing to bring the patient back into the office. All of the procedures that we consider require some basic information. Two things required for all requests are that they have current pain, documented to be at least 6 on the 0 to 10 scale, or causing some functional disability. And there's a difference between things that they can no longer do or can only do with difficulty because of pain, or things that make pain worse. An example would be saying that the patient has standing tolerance of only about 10 minutes before they have to sit down is a whole lot different than telling us the patient's pain is worse when they stand up. The first is a functional disability. The second doesn't count for anything towards the medical necessity documentation. Also, we need to see conservative therapy, the active components, either formal physical therapy, a physician supervised home exercise program, or chiropractic care for at least 6 weeks within the past 6 months or since a prior injection. Facet and sacroiliac joint injections require that the patient has had their pain for a duration of at least 3 months. Facet injections also require that the pain is mainly axial. Now, we realize that most of these patients have pain from more than one source. What we need to know is that the pain that is predominant is the axial pain, and that's the pain that you're treating with the facet injections. Sacroiliac joint injection requests require the results of a provocative examination. And that's because most pain in the area of the sacroiliac joint is referred pain. A provocative maneuver done during exam that reproduces the pain helps to distinguish referred pain from pain with its origin in the sacroiliac joint. We can also approve requests for acute radicular pain without the patient having to do 6 weeks of physical therapy. We just need to see two things documented. We need to know that the pain has an acute onset. Unless you put that in your notes, either using the word acute or telling us last month the patient was working in the yard and that evening started feeling pain going down his leg. Unless you have something like that in the notes that tells us when it started, we won't know. So we need to know that it is a relatively acute onset and we're looking for that 2 week to 2 month time window. And then we need to know that there's been something tried for at least 2 weeks. This can be physical therapy, but it doesn't need to be. It can be oral medications, bed rest, altered activity, almost anything. We just need to see it in the document. All repeat injections require documentation of how much relief they got from the previous injection or improvement in their function as a result of the previous injection. We also need to know that their pain has returned again to at least 6 on the 0 to 10 scale, or that they have some residual functional disability. And we need to know that they have continued with their active components of conservative therapy since the previous injection. Repeat therapeutic injections also require documentation of the duration of relief or duration of functional improvement since their previous injection. Radiofrequency procedures require at least 70% relief from a diagnostic medial branch block or 50% relief lasting for at least 4 months after a prior radiofrequency procedure at the same joints. This is the conservative treatment form. It's kind of small on this side, but it's here to make sure that I talk about it. We understand that sometimes, in fact, almost all the time, when you get a new patient referral, the patient has already had conservative treatment ordered by another physician, and you may not have those details. This form is designed to be part of your new patient intake packet. It can be provided to you in electronic form so that you can edit it, put your logo at the top, and make it look like the rest of the forms in your intake packet. But the idea here is to get the patient to provide the details necessary about the conservative therapy they had, when they had it, what the duration of therapy was, so that when you put in your request, that information is there. You don't have to worry about getting a denial for lack of details about the conservative therapy, and then having to call the patient to get those details and submit them to us again. So please utilize either this form or some other way of gathering that information from the patient right up front. And then you've got it in your documentation, not just for us, but for anybody else you may need to provide it for. I highly encourage you to take advantage of your peer-to-peer opportunities, especially if you have any questions at all about the denial letter that you receive. If you read that letter carefully, that first letter is not actually a denial letter. It tells you that there has been a preliminary review, and based on that review, there are these deficiencies, and they're listed. If you have any questions about those, call us for peer-to-peer conference. We can tell you exactly what you need to provide in order to turn that into an approval rather than allowing it to become a final denial. You will still have to provide the information to us in writing, but be aware we can take anything that you put in your patient charts. That can be phone notes, that can be notes made by your medical assistant, your scheduler, or anybody else that you authorize to put notes in the chart. We can take those notes as documentation to meet the medical necessity criteria. Whenever you upload that information through the RadMD website, it is available to us immediately for review. If RadMD is available to you, please use it because it's so much faster than the other mechanisms for getting the records to us. We also understand that not every patient fits neatly into the guidelines. If you have a patient that's that square peg that won't fit into the round hole, document the clinical situation and why you believe the procedure requested is indicated. Our physician reviewers all have the authority to exercise their clinical judgment to approve requests that do not neatly fit the guidelines. We just need the supporting information to be able to exercise that judgment and issue an approval. Also, be aware that all of our interventional pain management physician clinical reviewers are board certified anesthesiologists or physiatrists with interventional pain management practice experience. So they will know what your documentation is talking about. They'll understand it and they can exercise their judgment.
Thank you so
Back
much,
to you,
Dr.
Charmaine.
Thank you so much, Dr. Casaro. So we've included some valuable contact information for your future reference. Our web portal, RadMD, is the most efficient way for your office to submit authorization requests. With access to RadMD, users will also have the ability to review real-time authorization decisions, upload the clinical documentation that will be required for these IPM procedures, view and manage authorization requests with other users, view requests for additional information and determination letters, view clinical guidelines, as well as all of the educational materials to include a list of CPT procedural codes requiring prior authorization, a frequently asked questions documents, tip sheets, as well as other educational documents. Dr. Casaro discussed the benefits of our peer-to-peer discussions. These discussions can occur anytime during the authorization process once we're in receipt of your clinical documentation. These clinical discussions can occur with anyone in your office that has clinical knowledge of the case. So we've included the telephone number that can be used for these discussions. We are also providing our RadMD support telephone number as well as the email address for any technical support, as well as our provider service team's telephone information for assistance with general questions. Now, our provider relations team will be the point of contact for all provider outreach, education, and training activities. Provider relations managers are assigned based on the state or the health plan partner. So this link provides you with our contact information. We want to thank you for taking time to learn more about the Magellan Healthcare Interventional Pain Management Program. We sincerely appreciate your attention today, and this brings us to the end. Make it a great day.